Continue our conversation now on Condom Week and STI information campaign that the government will be running this week. And I'm speaking to Dr. Thato Chidarikire, who is the director of the HIV Prevention Programme at the National Department of Health. Now, Dr. Thato, just speaking about the STIs, you did mention before the break that they are actually manageable and some of them are curable. What are some of the symptoms that a person should look out for that will alert that person that they need to seek medical attention?
Right, thank you. There are some really basic signs that one should be looking out for. The discharge, for example, whether it's vaginal, penile, or anal, there is usually a discolored discharge like yellow or green vaginally, or white if it's penile or anal. There is a foul smell that one should look out for and can actually know that there is probably a challenge. We also look at issues of burning urine. Although, as we say, not all burning urine may be an STI. It could be something to do with the bladder. But when it comes with STIs, we need to ensure that at least the basic ones, like a discolored discharge or a foul smell, are actually the main things we look out for. But there's also, as I said, there's burning urine. There is a pain in the lower abdomen. All those can actually lead to signs and symptoms of STIs, or if not, it's always good to eliminate so that one is able to deal with the challenge at hand.
And can you tell us a bit more about the link between HIV and HSV2, also known as genital herpes?
So genital herpes, herpes simplex virus 2, as we refer it to, is actually a sexually transmitted infection that can actually increase the risk of HIV, because you will find that people may actually present with open lesions, which are usually entry point for HIV infection. So just like most STIs, we actually make sure that we request that when one actually has an STI, it's important that they actually treat. Because then while we are managing the STI itself, we are also trying to reduce the risk of HIV infection. As we know that STIs are actually a marker of non-protected sex, like non-condom use. So, yeah.
And just lastly, Doctor, can you tell us about the stigma relating to STIs? Are people very open about telling their partners? You mentioned a partner information sort of slip previously before the break. Do people actually want to tell their partners when they have STIs, or are they still shy about addressing the topic?
STIs obviously being related to sexual transmission, although this is anecdotal really, but it is still a bit of a challenge. It is still found as one of those issues that one does not talk to. So it takes a lot of empowerment and open communication between partners. So that's what we actually encourage: open communication between partners, empowerment of partners, within their relationships, so that they are able to negotiate issues of safe sex, for example, condom use, because this is one of the things that will actually reduce the transmission and or acquisition, as well as treatment, because if only one partner is getting treated, they're going to get reinfected when they keep going back to the partner that has not gone for treatment. Mm-hmm. So there is a challenge of communication that we are trying to ensure that we address, as well as empowering our partners to ensure that they have open communication within their sexual relationships.
Now, I know your focus is mainly on the HIV prevention programs within the government, but it's also this coming week will be a Pregnancy Awareness Week. Are you able to touch a bit on that for our viewers, just to let them know what that entails or what it's about?
When we come to Pregnancy Awareness Week, we are actually now ensuring that if one is pregnant or intending to fall pregnant, that they understand what support they will get. So it's also a way of sensitization, that now that one has actually conceived and one is actually now going to go through a journey of pregnancy, we ensure that we support safe pregnancy to reduce maternal mortality and morbidity, as well as neonatal mortality and morbidity. So again, Pregnancy Awareness Week really is kind of like self-explanatory in the name, that we want to ensure that our pregnant mothers, whether young or older, actually are aware of the support that they can get, the rights that they have while they go on their journey, so that they are able to get there and they have healthy children at the end of it all.
Thank you so much for joining us this afternoon. That was Dr. Thato Chidarikire, who is the Director of HIV Prevention Programs in the National Department of Health.